Let's talk about dissociative identity disorder in childhood. Yes, it's a thing. Yes, it occurs to kids. It actually develops in childhood. But we'll explain more here in a bit. Hi out there, this is Dr. Brett Pearce, child psychologist, coming at you with another educational video. Today we're going to be talking about dissociative identity disorder, also known as DID, formerly known a long time ago as multiple personality disorder. Specifically, we're discussing this disorder in kids because I get a lot of questions about whether or not this disorder can occur in kids. And the answer is yes. In fact, it develops in childhood. We'll talk more about this here in a bit. Dissociative identity disorder effectively is a kind of trauma disorder, though it's not formally classified as a trauma disorder in the DSM. However, it is very well known to effectively only occur in the presence of usually pretty chronic, pretty awful early childhood trauma. And by early childhood, I mean something like, ages 0 through 8 or so. The most common scenario with dissociative identity disorder is sexual abuse, but certainly not only. Dissociative identity disorder, or DID as we'll call it from now on, just so I don't have to keep saying dissociative identity disorder every 3 seconds, but DID is a lot more common than most people think, in my opinion. It's also a strangely divisive diagnosis in the field. The reason for it, I think, is because there was a period decades ago where there was a lot of claims by people of having this disorder and having been abused in a ritualistic fashion by cults and things like that, that were later sort of debunked. The intention behind that video isn't to necessarily dive into this topic too much or to endorse or deny those things, but merely to offer a little bit of history on, I think, why the field became skeptical. And it's come to the point where you have many professionals in the field of psychology and mental health who take an interestingly polarized stance, where many simply will not diagnose it, either because they think it's not real or they think it's exotically rare. And they tend to treat the disorder differently from how they would treat basically any other disorder in the field of mental health, which is to say they will regard it with something that goes beyond skepticism and starts to step into active disbelief, basically requiring almost extraordinary evidence in order to make the diagnosis. So let's talk a little bit more about what dissociative identity disorder, or DID, is. So DID basically represents the kind of person who, in more obvious extreme expressions of the disorder, will literally have multiple personalities. They will often refer to themselves by different names and will have substantial changes in their mannerisms and their behavior, and sometimes their appearance in some circumstances, depending on which personality, or sometimes they can be called alters, or sometimes perhaps dissociative parts, depending on which one is kind of driving the show. And quite commonly, there is a lack of awareness between the parts, especially kind of the person's usual personality. So an example of this might be, maybe you have someone who suddenly loses track of half a day and literally does not remember it, come to find out that their friends said, you were acting really strange and you insisted on calling yourself something other than what you were called, and you were kind of acting differently. Don't you remember that at all? And the person doesn't remember it. Why does dissociative identity disorder occur? Well, it's actually, like a lot of mental health concerns, represents an extreme and or problematic version of something that is relatively normal and actually can be quite functional. So dissociation itself means some kind of problem with the normal continuity of consciousness for the person, meaning something like daydreaming can be a kind of dissociation, really. Daydreaming is also a relatively normal thing to do, and it can actually be a kind of coping mechanism. So, for example, let's suppose that you were, I don't know, at school and you were really exhausted, you were really stressed out, you were counting down the minutes before the day was over, and perhaps you were in your least favorite class and listening to a lecture that you really didn't want to listen to. You might find, especially if you're a person who's particularly imaginative and maybe easily hypnotizable, and yes, people vary on that, just like almost any other thing. Some people are really highly hypnotizable, some people are kind of in the middle, and some people aren't really hypnotizable. Maybe it's easy for you to really daydream to the point where you are, you're awake. You're not like asleep or something like that, but you are daydreaming and you're not really registering what's going on around you too well, but you're going through a kind of daydream. So, and probably the reason you're doing that is in order to try to keep yourself occupied and together and to kind of escape, as it were, if we want to use that word, the stressful things that are going on around you, or at least, the not so interesting things that are going on around you. And what happens is that kids and people who have dissociative identity disorder tend to have an extreme version of that. And when you have a kid who experiences really intense, horrible stress and trauma chronically, particularly if that kid is the kind of kid who maybe easily daydreams, perhaps is very imaginative, things like that, that kiddo might start to develop these kind of pocketed off, almost trance-like dissociative states that are so well developed and intense and occur when the kid is so young and their brain and their personality and their psychology is relatively malleable and is not as well developed. They start to develop these affective states that are kind of pocketed off in almost this like sort of hypnotic, sort of trance-like dissociative states. These are some of the ideas behind how dissociation occurs. And indeed, the dissociation does appear to be a kind of mechanism for coping with not only trauma, but also negative feelings in general. So there's usually a relatively specific organization to how these dissociative parts work with DID. Very commonly, you have the childlike part that is usually a little vulnerable kid who's in a lot of pain, and you can see how that connects with experiencing intense early childhood trauma. And then in reaction to that, you often have a part that is very angry and violent and protective in a sense. And that part is very frequently an older kid. That part is often very scary, but also kind of protective in a certain way. The bottom line is it's an angry, violent part who's usually there to say, well, we'd be better off sort of identifying with an abuser or kind of being tough and powerful and violent rather than being a victim. And again, I'm not endorsing any of this. I'm just trying to describe how this tends to look. And then very commonly, you can have any number of other sorts of parts around this kind of core structure that can look a lot of different ways. Sometimes they seem connected with regulating feelings and negative emotions really specifically, and other times kind of not. There can be a lot of kind of quirky or interesting or kind of anomalous things that'll occur. I've worked in circumstances where there's things like, well, this one part is a vegetarian, this other part is not, and things like that. The bottom line is the whole system is centered around basically kind of keeping the traumatic memories at bay and then often acting as like a preventative strategy for the kid opening up about what happened or the person opening up about what happened and forming safe, trusting relationships with people like, spouses or parents or foster parents or whatever. So dissociative identity disorder can also take on an almost supernatural quality to it, but it's not supernatural. But that's part of the reason I think sometimes there's skepticism around it, or persons with including kids with dissociative identity disorder can often be called more like traditionally psychotic or schizophrenic, because there are indeed very commonly, technically speaking, hallucinations that occur. But these hallucinations are almost always organized around the dissociative process and or are connected with trauma memories, and they're kind of like flashbacks in a sense. You could sort of think of it as kind of like a really vivid and intense and problematic version of having had a horrible dream that you really don't want to remember, but it keeps kind of bubbling to the surface in certain ways where maybe you're kind of really vividly experiencing the dream. Comparable things to this, in a sense, can occur in PTSD as well. In some cases of PTSD, people can experience dissociative symptoms that are so powerful that the person, when they're triggered, becomes not so responsive to their immediate surroundings because they are so dissociated into an intense flashback related to the trauma that they are there basically in the flashback and are not really aware of their surroundings. It's rare for it to happen exactly in that extreme way, but it does, absolutely, which is to show you that DID is an extreme and problematic version of something that's actually, relatively normal, so to speak. So, in terms of hearing voices with DID, very commonly the person is hearing their dissociative parts talk to them. Very often, one way I'll help identify it is to say, okay, so does your kid have imaginary friends? Which, by the way, by itself is not really an indication of a problem. Kids who are very imaginative very often do have imaginary friends, and that's fine. That's no problem. But where it starts to become a bit alarming is when we find out that these imaginary friends are often telling the kid to do horrifically violent things to themselves or others, frighten the kid, or have truly horrific qualities. Like, we'll hear accounts of dissociative parts that are truly terrifying and almost sound like something out of a horror movie, which is not me trying to make light of it, but to indicate that these things can really almost be fantastic. And that's because if you're in, sort of something like a daydream or something like that, you can see all kinds of things. And in a sense, you could almost see whatever you want to imagine. Comparably in dreams, which bear a relationship to this kind of state, all sorts of things can happen. People can see virtually and experience virtually anything in a dream. So what will happen is very frequently the dissociation is the most obvious and the most active when negative feelings are triggered. I can't tell you how many times with clients who are dissociative that I've heard that it's most noticeable when the kid is angry, and the kid will suddenly act very differently. I've even had parents say to me, and the kid suddenly adopted this look and mannerism and way of speaking, and that was not my child. And parents are very often, understandably, almost really scared to tell me about this because they think that I'm going to question their sanity or something like that. But actually, this really does happen with dissociative identity disorder. I've even seen some very interesting things happen where I've seen kids who have a very distinct speech difficulty with pronouncing consonants, but not when one of the parts was present. Then they spoke as clear as a bell, which almost sounds not possible, but there is grounds in the literature, and it is a known thing where there can be kind of these interesting dramatic differences. Mind over matter, I guess. The bottom line is DID is a thing. It does occur in kids, and it in fact develops in childhood, and in general with an older kid or an adult, teenager as well, if they experienced really horrific trauma, even in a chronic sense, you'd be probably talking about something more like PTSD rather than DID. Why? Well, it probably has to do with the fact that the person's personality and brain is stable enough and formed enough that even if some dissociation occurs during the trauma where the person's just trying to get away from what's happening to them in their bodies and their immediate surroundings, it's not likely to result in as dramatic and intense of a way that's going to result in segmented off personality and affective states. So DID is a really complex disorder. It's an intense disorder. in general, when someone has DID, including kids, it's usually associated with a lot of really intense emotional and behavioral difficulties. Things like really aggressive behavior, parasuicidality, suicidality, and then psychotic-like symptoms like hallucinations, as well as the outright dissociation, where the person will lose track of normal continuity of consciousness. So there could potentially be a lot to talk about. In terms of treating the disorder, there isn't exactly a special protocol or a unique treatment for it. We tend to treat DID a lot like we would treat a lot of other issues, except that you want to have a good working knowledge of DID and you want to be able to work with it. Just in the same way that if you were working with someone who is having a hard time, I don't know, maybe going to the gym to comply with a fitness routine because they have such severe social anxiety, you wouldn't want to just talk about them in terms of like compliance with a habit, productivity and motivation and things like that. Those things are fine and it might help the person, but you also want to be able to go, wait, hold on, I'm now getting that you have a lot of anxiety. One reason this is so important is that with anxiety, an understandable but sometimes unhelpful tendency is to avoid anxiety and avoid things that are triggering anxiety. In somewhat of a similar sense, with DID, the whole system is organized around avoiding, kind of reliving, in other words, remembering and healing and processing from the trauma. And, none of this is meant as a criticism, because if you're a little kid and have horrific things happening to you, it is understandable that you do what you have to do to survive. And it's also true of PTSD as well, that very commonly what we have to do is watch out for the defense mechanism of avoidance and try to help the person overcome that. Because pretty much any defense mechanism in the right context can be argued to be pretty reasonable. It's more about the person's repertoire of coping tools, as well as how well they apply them in whatever situation. To give you a quick example, if I were really stressed out about my cat's health, and I don't think she's made an appearance in this video yet, which is interesting because she normally likes to, come say hi. But if she were really, really sick and she was at the vet right now receiving care and there wasn't really anything I could do, it would make sense that just trying to distract myself from my stress and anxiety and heartbreak over the possibility that she might not get better, because there's nothing I can immediately do right now while I'm waiting to hear back from the vet. So it makes sense in a way to avoid or perhaps distract in that moment. However, if my cat were sitting on the floor right now, really sick, and I was really nervous about that, it wouldn't make sense to distract or avoid in that moment. What I would really need to do is take action, right? And so it just goes to show you that any defense mechanism, including dissociation, probably in certain circumstances is reasonable. And sometimes we, including kids, do what we have to do to get through a tough situation. So this is a little bit about DID, and just to throw it out there, because it's one of those disorders that a lot of people think sort of doesn't exist or is exotically rare. I think it's a lot more common, which is not to say that I think it's common. I just think it's a lot more common than most people realize. I have diagnosed quite a few cases. I've treated, some cases of it myself as a therapist. And for some reason in the field, you'll have some people who seem to treat it as though it doesn't exist, and they basically never diagnose it, even in circumstances where, if you ask me, it seems pretty clear that it's going on. So just my 2 cents on the subject. Please look forward to seeing more regular posts from me. I know it's been a few months. I've just had a few other things on my plate, but I am looking forward to getting back in front of the camera and offering you more Dr. Pearce lectures on the subject of child mental health soon. Take care. Bye-bye.